Hello, and welcome to SW336. My name is Douglas Davis,
Good morning, I'm Drea James.
and today we're going to do our disease and recorded health issue on the HIV and AIDS virus. What is it exactly? HIV stands for Human Immunodeficiency Virus, and AIDS stands for Acquired Immunodeficiency Syndrome. Today we are going to discuss the description of the disease, or the health issue, causes and symptoms of the disease, description of treatment methods, the potential psychosocial impact the disease may have on the patient and family, possible coping strategies for the patient, and description of how the medical social worker can assist in the treatment or teaching of coping strategies to use. Now, for the first one, we're going to have description of the disease.
My name is Kaniqua Tillman, and my group decided to do the illness of HIV/AIDS, and I'm just going to give a brief description of the health issue in the disease. HIV/AIDS is an immune deficiency that interferes with the body's ability to fight infection and disease. HIV can spread through contact with infected blood, semen, or vaginal fluids. There is no cure for HIV/AIDS, but medication can control the infection and prevent disease progression. Some people with HIV develop flu-like symptoms 2 to 4 weeks after getting the virus. Some people taking HIV medication may not have other symptoms for years. As the virus multiplies and destroys immune cells, symptoms can develop such as fever, fatigue, swollen lymph nodes. Untreated HIV typically turns into AIDS. Untreated HIV typically turns into AIDS in 8 to 10 years. That is a brief description of the health issue and illness. Now I would like to share with you guys some causes and symptoms. So some of the symptoms look very similar to those of having a cold, a fever, or flu. Those include a fever, headache, muscle aches and joint pains, rash, sore throat, painful mouth sores, diarrhea, weight loss, cough, and night sweats. Some people affected by HIV get flu-like symptoms within 2 to 4 weeks. After the virus enters the body, this stage may last up to a few days or several weeks. Some people have no symptoms during this stage.
All right, that was great. Up next, we have description of treatment methods.
Hello everyone, my name is Addie Knowles, and today I will be discussing the treatment for HIV and AIDS. So first I'm just going to start off with some basic information. So the treatment for HIV and AIDS is also known as antiretroviral therapy, or ART for short. So the treatment for HIV/AIDS just consists of taking your medicine prescribed by your healthcare provider. So treatment can reduce the amount of HIV in the body, and it will help keep the patient a lot healthier. So there is no cure for HIV or AIDS, but it can be controlled with treatment. Most people can get it under control if they're taking the treatment correctly in about 6 months. Treatment for AIDS and HIV does not prevent transmission of other STDs. So now I'm going to be talking about when the treatment should be used. So patients should be using treatment as soon as possible. So as soon as a patient finds out that they have been diagnosed with HIV or AIDS, they need to start treatment immediately. All people diagnosed with HIV or AIDS should be going through with treatment, no matter how long they've had it or no matter how healthy they think they are. The treatment will be a lifelong thing because there is no cure for HIV or AIDS, and it is a sickness that needs to be controlled. So if you accidentally delay your HIV or AIDS treatment, it can cause extreme harm to your immune system. The patient will be at a higher risk for transmitting it to their partners or other people, and they can get very sick. And if you only have HIV, if you delay your treatment, it can then develop into AIDS. So there are two different kinds of HIV and AIDS treatments. So the first one is going to be an oral pill, and the second kind is going to be a shot. So the pills are normally what people start out with when they first start their treatment, just so that they can reduce the HIV or AIDS in their body, so they can get the viral load down in their bloodstream. So basically, the amount of HIV or AIDS in their bloodstream, so that once they've been taking the pill for so long, they'll continue to get blood tested and see how much is in their bloodstream, and it should be going down. So most of the time, people will stay on those pills for a while until they have been virally suppressed for at least 3 months. So that means like a very, very low amount of HIV or AIDS in their bloodstream, or completely undetectable viral load. So then once they've hit that 3-month mark, you'll normally transition into taking shots. So the HIV/AIDS treatment shots are long-acting injections given by a healthcare provider. They can be given once a month or once every other month. It really just depends on the patient's treatment plan. And it is very important to take those on time and not miss them, because you can get very sick or the treatment will not work as it's supposed to. So some benefits of HIV and AIDS treatments include an undetectable viral load, like we just said, or your viral load will be like extremely low. Again, that doesn't mean that it has gone away. It is still there, because HIV and AIDS are not curable, but it is very controlled at that point. So you'll know if your treatment is working if when you're getting your blood test, if your viral load is extremely low or even undetectable. So if you skip your treatment, the HIV can multiply rapidly and the patient will get very sick. Getting and or keeping an undetectable viral load or staying virally suppressed is the best way to stay healthy and protect others. So that is why it is so important to take your treatment as prescribed, because it will keep you healthy and it will keep your partners healthy as well. So treatment can also prevent transmission to others. So if you have an undetectable viral load, HIV will not be transmitted through sex. So basically, undetectable means untransmittable. HIV and AIDS treatment has been known to cause some side effects. Not everyone experiences side effects, but it can happen in some people. So the most common side effects include nausea and vomiting, diarrhea, difficulty sleeping, dry mouth, headache, rash, dizziness, fatigue, and if you are getting the shots, temporary pain at the injection site. So some of the most common FDA-approved drugs for HIV and AIDS are, which I'm going to try to pronounce them the best I can. So the first one is abacavir. The next one is datanacine. The next is emtricitabine. And then lamivudine, stavudine, tenofovir, zalcitabine, and zidovudine. That is all the information I have for you today on the treatments for HIV and AIDS. Thank you.
Up next, we have the potential psychosocial impacts the disease may have on the patient and family.
Again, the psychosocial impact that the disease may have on the patient and family is probably one of the most difficult aspects of dealing with this diagnosis. Emotionally, there could be feelings ranging from fear to grief to disbelief. The grief is probably one of the most prominent ones that's seen, being as how the person is grieving for their previous life and moving on to a different way of living and accepting. It is very important to get those emotions out, to share those either with someone you trust, with a support group, or even if it starts out with just journaling and getting that out so you're not holding all of that in. As you're receiving medical treatment, it's very important to make sure you're taking good care of your mental health and your social well-being as well. Those things are critical when it comes to your medical health and with you proceeding through this journey. One of the things that you also want to be aware of is that there may be some anxiety that goes along with this. There may be instances of depression. It is very important that in addition to seeing your physician and going to medical treatment, that you're also going through mental health screenings. A lot of times this can catch things early on, and there can be interventions made with your medical team, with your counseling team, and just in general with your family and loved ones, and as well as you can start to prepare yourself mentally for this journey that you'll be going on. A lot of these screenings may seem like they're being invasive. They may seem like the doctor's being nosy or just trying to get too much information, but it's actually a chance so that we can get a hold on all of the aspects and treat the person and their emotions as they're going through this difficult experience. Another aspect that's very, very important to your psychosocial aspects is your family relationships. This can change family relationships very drastically, whether it be with a parent, with your partner, with children, extended family. It can put a lot of emotional strain. A lot of times your family is the closest to you and they will be helping you through this journey. Sometimes families don't accept that, and you have to learn how to work with that, find a support team, support system. Another thing that people struggle with is how to maintain healthy relationships. With that, you also want to take into consideration your partner's feelings. If you want to continue the relationship, there's so many aspects that no one can decide for you, but what we can do is help you cope with those feelings and help you develop a way to determine what you want to do and proceed. Every decision doesn't have to be made right away, but it's really important that you go over all aspects, including how you're going to deal with, if you're going to tell the partner those things. Another thing that people want to know and they dwell on is, will this change me? It is going to drastically change some parts of your life. There's no way to sugarcoat that. Your life will change. It does not change the person who you are inside. There are still many things that you can do and go on and live your life to the best of your ability. This is a big change, but again, it's a part of who you are now, but it doesn't change who you were before. So yes, your life will change, and being in touch with mental health professionals, your social worker, your doctors, counselors, support groups, those things can all help with those aspects of this diagnosis.
Wow, that was incredible, Julia. Thank you so much for that. I thought that was very well informed, very detailed. I think that's exactly what the upcoming or current, HIV or AIDS patient would like or need to hear. Our next part will be the description of the possible coping strategies for HIV and AIDS patients. What I'm about to say will reflect much of what my colleague has just said in the most recent part, so they do run parallel. So first and foremost, find local or social media groups. More now than ever before, on Facebook, Instagram, Twitter, anywhere where there's a social media platform, there are going to be special populations for everything. There's going to be communities for everything. And HIV and AIDS are no different. Find HIV or AIDS populations on social media and reach for emotional support and other support to help cope with living with the virus. Additionally, once you are more comfortable with this new reality that you are to face, you can help provide guidance, help, emotional support, whatever it may be, to people, just even if not your local community, then all across the world, all with the help of a social media platform. Find activities or hobbies that you enjoy. Again, you are still the same person that you were before, but make sure you find what it is that keeps you occupied, what it is that keeps you healthy. Whatever you liked doing before, Whatever that brought you happiness and joy before, keep doing it. Don't change. Attending therapy or counseling services with a licensed professional. If you feel that you need therapy or you need counseling and you're just struggling to cope with the stigma, the physical side effects, just the reality of having HIV or AIDS, seek therapy. Now, there are very few licensed professionals or counselors who specialize in or helping those with HIV, but most of your therapists and most of your licensed counselors out there are more than willing to see you. They are more than willing to learn about what it is you struggle with. And so even if they don't know about something specifically, they weren't trained for this, they want to hear from you. They want to know how is it they can treat you in the best way that they can so that they can provide the best service to you with this thing that you struggle with. So just give them a chance. Give whoever this may be that you seek therapy with. Just give them a chance. Understand the current climate of the virus and understand it is not a death sentence the way it was before. Reach out to friends and family. If they do not understand HIV/AIDS in the current era, just briefly educate them on the matter and the fact that you are just the same as you were before. Like I said, like my colleague and myself said, your life is going to drastically change, but everything that you are, everything you did before should be the same. Learn and practice relaxation techniques to reduce stress levels and enhance mindfulness techniques. In my personal experience, I learned that a mindfulness course that I took greatly enhanced my overall social and mental well-being. And I believe for someone who may be struggling with the reality of this virus, it may help to reach out for mindfulness techniques, whether you see someone locally or professionally, or if there's anything you can find online, because there's plenty of information online for mindfulness techniques. It is something to consider and something to practice to help cope with your everyday, day-to-day life. Continue to take your medications as prescribed. Like any other medication that a licensed professional has prescribed to you, that you are to take a certain time of day or certain times in a day or even certain days in the week, this medication is no different. However, there's more of a life dependency aspect of this medication. So people can go a day or two without their regular meds. It could be a whole range of problems from blood pressure to anxiety, and they'd be okay. These, I would think, these definitely need to be taken every day. Nothing should be skipped. Continue to take your medication as prescribed, as I just said, but if the side effects are unfavorable, contact your doctor or medical support team. Like anything else, if the side effects are too intense or they're causing too much harm, contact your local or your medical professional that prescribed you the medication and see what it is they can do to help you. See if there's something else they can prescribe you with. HIV medications, there are only so few brands. There are generics too, but I did think that there is a regimen or a type that may help you, whereas one didn't. And if you don't know where to go or how to get asked to get help, reach out to your medical social worker. Your medical social worker, again, does not know everything A to Z about all things medical problems, all things medical concerns, all things diseases, viruses, conditions, cancers, but they know a lot. And their job is to help you cope, and they'll help you get what you need, help you with transportation, whatever it is that their job entails, it is to help you, the patient. All right, up next, we also have, last but not least, description of how the medical social worker can assist in the treatment or teaching of coping strategies to use.
Okay. Again, a lot of this is going to overlap with what my colleague Douglas had mentioned previously. Medical social workers can't do everything, but they do have a tremendous role in your well-being. One of the things that we can do is express the importance of medication. Again, while I may not be an expert or we may not be experts on each medication, we can find out the information, help you go through the side effects and see how that's affecting your life, and also to kind of help you be aware of the changes that it may be, whether it be diet or those type of things. We can also point you in the direction of care, of different aspects of your care team, and that type of thing. We can assist you with knowing where to go, when to go, who to call. You'll probably have several doctors for several different things. So we can kind of help you with building that, the guidelines as to where to go and to who to go to. Another thing to consider is transportation. When you have a lot of appointments and ways to get there, and let's just say you're not feeling too well to drive, we can help you with either getting some type of specialized transportation, learning your bus systems, or even with Uber or those type of things. We don't always think about transportation as being a barrier, but sometimes it can, especially if you do have to travel to a specialist that may be out of your area. We can also...
So for family meetings, it is important that the people in your life are aware of this condition that you have. Now, unlike some other diseases or viruses out there, like cancer or something else that is also just as serious and that can be life-threatening, there's unfortunately still a social stigma with HIV and AIDS. However, it's important to keep your family and friends up to date about how this condition affects you. However, it's not always easy to just sit down with them in a usual casual spot and describe to them and tell them or even confess to them this life-altering condition you have. So as social workers, we can host family meetings. So for you, the patient, for the parents, family, loved one, whoever involved, and the social worker. Together, the three of us or three parties can work together to discuss and help relay the information so that everybody's on the same page and everybody can understand things.
Okay. We can also assist with navigating through the insurance system, through Medicare, Medicaid, all of those things. Like many medical conditions, HIV, AIDS diagnosis would come with lots of medication, lots of hospital, doctor's visits, and things like that. Unfortunately, those can be costly. There are systems in place to help assist you and your family with those costs, but it is difficult to understand and navigate. We can connect you with benefit specialists that can go over in detail the differences between your personal insurance, or if you would need additional assistance. They can also go over with you other methods of obtaining things such as food if you need it, or shelter and those type of things. So it's very, very much a part of your life to have a benefit specialist or a medical social worker that can connect you with that resource as well. Education.
So for anonymous education, it would be beneficial to provide anonymous data to your local county so that they can update statistical reports of what the HIV populations are for the county or region or state.
Yeah, and that's another aspect that's very important. It's just to make sure that everyone that you've encountered is safe or is getting the treatment they need if so. And finally, one of the big things we can do is help you dispel the myths and stigmatisms and things like that go with this. We can give you accurate information, and if we don't know it right away, we can help you find it or find out what exactly needs to be relayed. But there's a lot of myths, there's a lot of things that are floating around that may not be true, so we can help you almost like fact check some of those things that may come up with this diagnosis.
Again, very well. I couldn't have said it better myself. Thank you for that. So let's take the time to talk about the social impact, like I only lightly touched about. So one thing to understand about the AIDS and HIV virus is that it is not what it was in the 80s or most of the 90s. It is not a death sentence. However, it is important to keep in mind that this is a life sentence. Now, you may think of life sentence as a prison term, okay? And I can see well, that might be a hard reality to accept, and rightfully so. It is a hard reality to accept. However, the treatments that are available now that were prescribed or that were discussed from my colleagues can give you an idea that this is not how it was before. There are a lot of people currently alive all around the world who live with HIV, and they continue to live normal, otherwise healthy lives, or still healthy, but it is important that this will be a part of you the rest of your life until there is a cure. That's the word, cure. So I would think that compared from between the 80s and now, HIV is not taken as seriously as it is. There seems to be more of a lax, careless approach to it because it's not as relevant as it was at its peak or in the 90s. And I think that is concerning because just because it is not as common anymore, or that you don't know someone with it, or that's not talked about or publicly displayed the way COVID is, or cancer, or anything else that we see advertisements and just know many people who have, this doesn't mean it should not be taken seriously. What do you think about the social aspect of this?
I think it's very important to realize that even if you don't directly know someone that has HIV diagnosis, or they haven't told you that, that doesn't mean that there isn't someone in your inner circle that is going through this journey or has someone close to them going through this journey. It's very important to be aware of that this is a possibility. If there are precautions that can be taken, it's very important to make sure you readily use those. There's a lot of, basically this has, in the 1980s, it was just this big boom and everybody wanted to spread information, and out of that came a lot of misinformation. This is something that can happen to any and everybody, no matter what your walk of life is, socioeconomic status, race, gender, sexual orientation. This is something that affects every single one of us. And so it's very, very important to keep that in mind. And also for people who may not have HIV, but you may be close to someone, or you may encounter someone that is going through this journey. So it's really, really important that you're aware of the actual truths surrounding the diagnosis versus the myths that have been so readily spread around throughout the years.
Well said. I, again, could not have said it better. I think your description of how this is between then and now, I think is very formative, and I think people should understand this, that, again, it is not something that will ultimately take your life so long as you do what is prescribed to you from your medical professional. It is important you just, again, live your life, take the medications, practice preventative techniques, tell your partners, and use protection when need be when engaging in intercourse and other means of how the viruses has been previously been stated of how it is transferred and acquired. And I think you will be okay. Is there anything you would like to add?
Just that in addition to the medical aspects, make sure you're taking care of yourself as well. Your emotional, mental health, and that are just as important as your medical treatments.
All right, thank you very much. All right, well, that concludes our disease and recorded health issue group presentation. Thank you very much for your time.